2, 1. We're live. Hi, everyone. Hi, Dr. Delgado. Hi, Dr. Cash. How are you?
Hello.
Doing well, thanks.
Welcome to everyone who's joining. We'll spend just the first few minutes introducing the guests, the speakers, giving everyone enough time to join. We are very excited about this webinar. We called it If Cats Could Talk, and really the main theme is how to understand signs of pain in our cat, how to know if something is wrong, and it will all be related to dental health and dental care. We'll touch upon, brushing your cat's teeth as well, how to get them acquainted and acquainted with the toothbrush, but just used to having their mouth touched. And we are very happy to have Dr. Delgado here as our special guest. Dr. Delgado is a scientist, a feline behaviorist. Do you want to introduce yourself to the audience, please?
Yeah, absolutely. I am Dr. Mikel Delgado, and I am a cat behavior consultant at Feline Mind. I have been working with cats for over 20 years and helping their cat owners. So today I'm going to be talking to you all about pain, dental pain, and your cat's mouth.
Nice. And Dr. Cash, welcome. Hi. Dr. Cash is Basepaws Chief Veterinary Officer. So she's one of the main brains behind our new dental health test. Dr. Cash, what is the new Basepaws dental health test? We started off as a DNA company. Why are we all about dental and what it is? What is it?
Thanks so much, Nadia. And Dr. Delgado, so glad to have you talking about this really, really important topic. I think just as a veterinarian going through, vet school, we don't actually think a lot about behaviors and dental health. So those are two things that, we don't spend a lot of time learning about. So that's one of the reasons we actually work together with our awesome customers who've sent us thousands of DNA samples. And that's how we kind of came about developing this dental test was we were already looking in the mouth, collecting saliva. So then we started to learn that, hey, there's actually more information here that's telling us about dental health, but also health overall. And that's through the oral microbiome. So one of the ways that we can actually learn about the top 3 most common dental diseases, so periodontal disease, halitosis, and tooth resorption, is by looking at this dynamic changes that are going on in the oral microbiome. And that's actually a really good early indicator to helping us know, is my cat going to be in some kind of discomfort and pain? Because they definitely won't tell us unless it's really way too late. So that's, again, one of the great reasons that I think this test will be life-changing for some cats that, we've seen. So I'm really excited to be able to offer this to customers and cats and veterinarians. So I'm really excited to have you kind of talk to us a little bit more about pain and the mouth and everything that we can do better in terms of helping our cats.
Great. And the way today will go is Dr. Delgado will spend the next 30 or so minutes going through her presentation. She has some amazing slides. This webinar will stay on YouTube, so people will be able to rewatch, and you will all be able to rewatch. And then after about 30 minutes, Dr. Cash and I will jump back on, and we'll be taking your questions. So if anyone has a question for Dr. Delgado, please write them in the chat box, because we are all able to see those questions, and we are able to pop them on the screen like this. This is it. Let's start. We're very excited, and let's go and learn.
Excellent. Yeah, I am super excited to be here and talk to you about this very important topic that I think maybe is neglected a bit. I think a lot of us don't really think of dental care as kind of the most important thing we should be doing for our cats. And maybe it's not the most important, but it's definitely very important. So I'm just going to walk you through my plan for this talk. We'll start with just a little background on cats and pain. We'll talk about specific signs of pain that you can look out for in your cats or cats you work with, whether you work in a shelter or veterinary clinic or, like I said, your cats at home. And then to kind of tie these topics together, we're going to talk about dental problems and pain specifically. And just to be clear, I'm not a veterinarian. I'm not that kind of doctor. I have a PhD, so I will not be necessarily getting too into the nitty-gritty, into the medical issues that I'm not qualified to speak to. Dr. Cash can hopefully help with any of those questions later. But I will be talking about kind of the big picture and certainly how it ties into pain signals in cats. And then the bulk of the talk is really going to be about how can we help our cats have the best dental care possible without hopefully causing problems in your relationship with your cat. A lot of cats are really sensitive around the mouth, so we have to approach with consideration and care. I will end with some resources for you, so some websites and videos that I recommend you check out if you want more information, and then we'll have time for Q&A. So without any further ado. Okay, so cats and pain. I'm sure you've heard this, that cats are notorious for hiding pain. It's because they are. And, you know, really, we tend to characterize cats as these big, tough predators. They're killing mice, they're killing birds, but they're also prey animals, which means they're susceptible. And in general, their MO is to stay safe and to not put themselves in a situation where they could be in danger. We know animals that are injured and that are in pain are vulnerable to attack. And even if your cat lives inside and there's no predators inside your house, they are going to still have those instincts to go into that kind of self-protective mode when they're suffering. So you will, if you pay attention, you will see signs of pain, but they can be very subtle. And for most cats, they're going to, like I said, go into survival mode. They're not going to be obvious like, you know, some of us, if we have a headache or other pains, we're making a big deal about it. Your cat's probably not going to make a big deal about it, especially if it's kind of a long-term, lower grade pain than something acute like they have a broken leg. What I think complicates this is that we often normalize signs of stress in our cats. People think hiding under the bed is just a normal scaredy cat behavior. They think cats are grumpy or don't like being petted. And sure, some cats don't like a lot of handling, but that could be a sign of a pain issue with your cat. So you have to kind of know what makes your cat happy and what is changing in your cat. So you really have to pay attention to your cat's individual body language, their behavior, their personality. Are they experiencing changes that could indicate something's going on? And I will say too, you know, I think people have this dread. If they think something's wrong with their cat, you're just thinking like, oh, I don't want to take them to the vet. Maybe you don't want to put them in the carrier because that's very stressful. Or maybe you're thinking about a very expensive vet bill, or maybe you're a little scared about what might be wrong. And so you might procrastinate in seeking care for your cat. Maybe it doesn't seem so bad. Again, cat's hiding pain, so maybe it doesn't look that bad, but maybe your gut is telling you something's off, something's different. Why is my cat doing that? And so rather than kind of say, well, if he was really in pain, he would do X, Y, or Z, think about, is this possible that my cat is in pain? What are the signs that I should be looking for? And like I said, I think sometimes we just want to kind of make it go away and see if maybe tomorrow things will be better. Well, maybe tomorrow things will be better. Then pretty soon, several days have gone by and your cat is silently suffering a little bit. So what can we look for in our cats? Sorry, let me get my slide to advance. First, think about the types of pain that cats can experience. Acute pain is something that happens onset, immediate. Injury, some kind of medical condition has caused acute pain that it has hit your cat like a sledgehammer. Maybe they had surgery and they have a wound. Maybe they got in a fight. But these are situations where the pain is generally intense, but short term. So it's not something that goes on. Unlike chronic pain, which is a persistent discomfort, we see this a lot in conditions like irritable bowel disease, or in cats, I think they call it inflammatory bowel disease, arthritis and degenerative joint disease. So these are long-term conditions where the pain does not just go away once you've gotten the medication or you've gotten the surgery and the wound has healed. This is something that goes on, and this can be harder to recognize sometimes and actually cause more long-term suffering for our cats. So this is where often, okay, like I said, if your cat breaks their leg, you're going to see it, you're going to notice. But if your cat has a stomach ache or your cat has pain in their hips or knees, you may not notice. So we want to look at how can we tell? And so the biggest thing you should be looking for is behavior change. You know your cat better than anyone else. You live with your cat day and night. I can tell you what the common signs of pain are, but I can't tell you what your cat's personality is on a daily basis. So you have to really be paying attention to, is my cat acting differently than they were yesterday, last week, last month? Things that might be more obvious would be like a decreased appetite, changes in their mobility. So suddenly your cat doesn't want to jump up on their favorite table or a chair anymore. Maybe they've stopped grooming their lower back. Maybe they're not using the litter box consistently. Maybe they've started hiding, which is a new behavior for them. So again, really thinking about changes. But sometimes there's also physical signs, like the picture of this cat. This is a cat who's hunched in a kind of scrunched up, tense position. They're kind of tucked up. This can be a classic sign of discomfort and pain. A cat who used to love being touched, but now is sensitive in certain areas. Maybe it's the face, maybe it's the lower back, maybe it's their paws. That sudden sensitivity is a warning sign. And maybe your cat is walking around like normal. They're eating like normal. They're, playing and doing things, but you notice, oh, wow, suddenly that area of his body is very sensitive when I pet there. So that's a change that you really have to pay attention to. So I would say the big red flags are just something's different. And okay, our cats all get like the zoomies or they do things we can't explain, but this is something where, again, your cat, trust your gut, and when in doubt, get it checked out. We actually have lots of clinical tools for assessing pain. So there's been quite a lot of research on pain in cats. And typically, this is how pain medications are developed by usually utilizing cats who have undergone spay surgery because it's a pretty heavy-duty surgery. And so they can test the effects of different medications as the cats are recuperating from anesthesia. So a lot of the research has been done to basically help us develop better medications to treat pain. And there are several tools available. I'm going to tell you about a few of them. For your everyday cat owner, I don't think you need to necessarily use a scale to measure your cat's pain. Certainly if you're working with lots of cats in a shelter or a clinic, having these tools is very handy. But the nice thing is that we can look at a few things very quickly and reliably and tell if a cat is in pain. And one of the classic signs is the distance between the points of their ears. So when cats are comfortable and relaxed, their ears are totally upright. They're, taking in information, but not putting their ears so far forward that they're like, I need information. It's really just I'm just here, my ears are up, everything's cool. The flatter the ears get, the further those tips go. You can see in this case, so the ears are going out, but they're not going back. So a cat who's putting their ears back is usually afraid. So in that case, they're making themselves small and they're trying to protect their ears from, say, another cat cuffing them in the head and giving them a cut in their ear. In this case, this cat is not swiveling their ears back. They're just flat out. And so when you see your cat kind of leaving their ears flattened for extended periods of time, that is a sign of discomfort. Now, you also can't just look at one thing and say, oh, my cat's in pain or my cat's fine. So we always want to look at the overall body of the cat. And this goes for anything about cat body language. There's no one thing that's going to tell you what your cat is thinking or feeling. You can look at their eyes, you can look at their tail, but you have to look at the big picture, the context, what's going on in the house, the cat's body, what position are they in, what were they doing, what are they not doing. But the other things we can look at is squinting of the eyes. So the tighter the eyes are squinted shut, that's a very classic sign of pain in most mammals, including humans. So squinting is a sign of discomfort and tension. So muscle tension in the face, throughout the body. But really what researchers have found is that the tense muzzle is a classic sign of pain. And you will see some of these cats also feigning sleep. So cats in clinics, cats in shelters, and sometimes in the home are kind of like the eyes are sort of closed, but they're not really relaxed and sleepy. So the Feline Grimace Scale, this publication came out a couple of years ago, I think maybe even last year. And this is a tool that's very easy to use. I love this tool because it's quick, easy. It's got a lot of reliability, doesn't require a lot of training or special knowledge. And so a lot of the things that I pointed out in the previous slide are from the Feline Grimace Scale. So again, we've got a cat on the left-hand side No pain or mild pain, so the ears are facing forward, large open eyes, relaxed face. You can see the whiskers are just drooping down in a very loose but not tense way at all, and the head is upright. The cat in the middle, we can already see those ear tips are starting to separate, right? So there's more distance between the ear tips. We've got slightly squinted eyes. We've got a little bit of tightness in the muzzle. You can see the lips are starting to pucker up a little bit. The whiskers are not drooping. They're out more. And the head is now lower. So the head is even with the shoulders rather than above the shoulders. And the cat on the right is a cat who is experiencing moderate pain or severe pain. So this is a cat who needs treatment and help ASAP. We've got those ears flat. We've got tension around the face, the eyes. The whiskers are again straight out. They're not drooping. And the head is below the shoulders. So really the things you can look at are the position of the ears, the tension in the face and the eyes, and where is the head in relation to the rest of the body. So cat in pain is going to be hunched. Their head's going to be lower. And you can go to felinegrimacescale.com to read about the research behind this scale and see more examples of how to use it. But like I said, this is a quick, easy to use, very reliable scale that can be used in many contexts. So this is, I think, a great resource for almost anybody with a kitty. Okay, now I've probably made you all paranoid. You're all staring at your cats, wondering if they're in pain. So hopefully they are not, but I'm glad that your attention is now like, let me make sure my cat's not in pain. But maybe you are afraid that your cat is actually not doing well. So what do? You call your veterinarian. This is a situation where certainly if your cat has a broken leg, you're going to go to the emergency room. If you just think like, my cat's not acting like herself, I don't know what it is, she's hiding or she's hunched over a lot, she's upset when I pet her, call your veterinarian, let them know what's going on, and they will advise you about coming in for an appointment. What you do not want to do is self-treatment. Don't self-diagnose your cat, and certainly do not give your cat over-the-counter medication unless your veterinarian has prescribed it. Many human medications are fatal. We do not want to be messing with pain medication. They can cause liver and kidney damage. So you really want to talk to your veterinarian. Pain control is critical. Like I'm definitely a big advocate of getting pain medication into your cat if your cat is experiencing pain. There are many excellent and safe options for cats, but you really need to talk to your veterinarian because there are some that are not so great. So you want something that is going to be easy for you to administer, be easy on your cat's body, and relieve their pain. And I will say there's definitely some great stuff on the horizon with monoclonal antibodies. There's some new pain medications that we'll be seeing probably in the next year or so. So definitely lots to look forward to because this issue has been getting increasing attention in the research world. And so I think that we'll have even more options for cats in treating them before we know it. We can do a lot to prevent pain. So that's probably the most important thing. You have a cat. How can we prevent them from ever experiencing pain in the first place? And probably the most important thing is to make sure that you are taking them in for their regular checkups and treatment from your vet. So getting them examined by a veterinarian once a year, even if they seem fine. It's super important for prevention to make sure that someone who is qualified, that's your veterinarian, is giving your cat's body a once-over. They're going to check their eyes, they're going to check their ears, they're going to check their teeth, they're going to check their stomach, they're going to check their skin. So we can really take care of a lot just by those wellness checks and doing them once a year. And if you have a senior or geriatric cat, you better get used to going to your vet more than once a year. Senior cats should go at least twice a year. And I think geriatric cats, well, if you can go 3 months without seeing your vet, you're in good shape. But I think geriatric cats should go 3 or 4 times a year. And the main thing is just that things can change with cats so quickly. They age faster than we do. And certainly when they get to be that old, a lot of stuff can go on. So you do not want to miss the opportunity to treat something early and extend their lifespan with good quality. I would also say again, this gets back to that idea of self-treatment. I think sometimes people think, well, I'll just give him this untested remedy that I found in the pet store or online. Really, you have to keep in mind that a lot of these treatments are not effective. So there's zero research showing that homeopathic remedies do anything. They're placebo. If you think there's any effect, it's probably you're imagining it, to be honest. And there's been research actually showing that with pain medication in cats. People who were giving a placebo to their cats perceived that their cats were getting better because they believed their cat was getting pain medication, but the objective measures of activity did not show any improvement in their cats. So we have to really understand what we're putting into their bodies and whether or not it's actually doing anything. And if you are giving your cat something that's not proven effective, whether it's homeopathic remedy or certainly a lot of people are really into CBD right now, and the research is not quite there yet to support its use, and certainly the quality is questionable. So you just have to keep in mind, if you are giving your cat that type of supplement in lieu of proper veterinary care, you may be making things worse. You may be extending their pain and discomfort. So if your vet says it's okay to use one of those remedies, then that's good, but do not try to self-diagnose or self-treat without veterinary care if you think your cat is in pain. So we're going to focus on the mouth now, just for a little bit, and really looking at the most common types of dental disease and periodontal disease. I'm not going to go into great detail. As I said, I'm not a vet. So, but what we see is like periodontal disease is disease of the gums. The most common version is gingivitis. So we're going to see a lot of inflammation in the mouth, discomfort. Tooth resorption is when the enamel of the tooth begins to break down, exposing a lot of nerves to the environment, which can be very painful. Abscesses is when basically there's infection in the mouth and pus is gathering into nice, delicious collections that expand and cause a lot of pain and disgustingness. And unfortunately, when that infection gets into the mouth, it can cause organ damage that can affect the heart and the kidneys and the liver. So it's not just the mouth that can be affected by dental disease. It can actually spread to other organs of the body quite quickly. And stomatitis is a severe inflammation in the mouth. The treatment is often removing all of the teeth. It is, it's an interesting condition in that it seems like the tissues of the body kind of reject, or the body rejects their own tissues. And there's some interesting stem cell therapy at UC Davis happening that hopefully will be available soon for kitties. It seems to be very effective, but stomatitis can be very painful for cats. So these are all things that can be problematic for cats. I think these are probably the most common dental issues, but Dr. Cash can correct me if I am wrong. So dental pain, how is it different from other types of pain? I mean, pain is, okay, we know pain, we know what pain feels like. Pain is pain, but also pain can be different, right? So depending on where it is in your body or whether it's like sharp and throbbing or dull. And so I think people don't always realize that their cat has dental pain, possibly because they're not spending a lot of time messing with cats' mouths. Again, that idea that cats are trying to hide pain, but also because people think that if cats have dental pain, they won't eat. Now, I can tell you all, I just had a temporary crown put in my mouth last week. I've been experiencing a bit of dental pain for a while now. There's some dental treatment delays due to COVID. I'm getting back on the dentist chair, but I'll tell you, I did not stop eating at all. No matter how much my teeth hurt or how sensitive they were, I still ate the ice cream. I still drank the hot liquids. I just dealt with it because you got to eat. So you really want to be looking for more subtle signs of dental pain. Honestly, it may not be apparent until your veterinarian gets in there and looks in your cat's mouth. So, you know, your vet may look in there and be, oh, okay, we've got a situation. And you may have not even noticed. You may see some subtle signs, like maybe your cat's chewing and eating more slowly, or maybe they're making a big mess while they're eating, food's kind of flying all over the place, which it never used to. Sometimes we see a lot of drooling, but again, some cats just drool a lot. So it doesn't necessarily mean dental pain, but it's just like a, let me just see what else is going on. Certainly some of the more obvious signs would be like pawing at the mouth actively, and or flinching when you try to touch their face, especially again, if these are new behaviors that you haven't noticed before. So dental pain can be a little different. I mean, I also wouldn't rule out seeing some of those other signs that we talked about. Even though the pain is in the mouth, you might see the hunched position, you might see the flattened ears, even though, again, the pain might be localized in the mouth. So big picture, pay attention, look for changes. And what we can do is try to, again, prevent dental pain by providing dental care for our cats. So again, getting back to the idea of prevention through wellness and maintenance. So what I would say is before you jump into a dental care plan for your cats, it's probably a good idea to talk to your veterinarian, see what they think about your cat's current dental condition. I will also say from my own personal experience and from working with cats in a shelter and working with clients, is just, it does seem like some cats are more prone to dental disease than others. And I'll be super interested to hear as this Basepaws dental microbiome project moves forward, if that is true, because I've definitely had cats who needed routine dental care and cats who never had a dental. And I can't say that there were a lot of differences in what I did as far as their dental care was concerned. So keep in mind that you can do everything right. You can brush your cat's teeth. Some cats will need veterinary cleanings no matter what you do. And maybe you haven't started a dental care program, so your cat might need a cleaning right now or soon. And so after cleaning is a good time to start a dental program. But keep in mind, you want to give your cat a few days to heal after they've had the cleaning, because there can be a lot of irritation after they've had dental work. So don't just jump in right away. And the other reason I would say don't jump in without talking to your vet first is that if your cat currently has any discomfort or pain and needs a cleaning, you do not want to be putting your hands in their mouth and like trying to brush their teeth when it's painful. So I always recommend start with a chat with your veterinarian and have them help you come up with your dental care plan. Now we're going to talk about some specifics. So yes, let's just look at the cat's teeth. So the felid teeth are pretty similar across species. And yeah, we are saying you should stick your hands in your cat's mouth. Wow, that seems a little risky. So we're going to talk about it. And just so you can know what are some of the different teeth in your cat's mouth. So the big fangs in the front are their canines, which they use to basically kill prey. So that they just cork right into the neck. They've got these little itty bitty incisors on the top, and those are what they use for like grooming and, biting at their fur and nibbling. And then on the sides of the mouth are the premolars and molars, which are also called the carnassials, and those are used for shearing meat into strips that they can swallow. So cats don't do a ton of chewing compared to maybe us. They do some, but really their teeth are designed to shred meat into slices that can just go down the gullet. Okay, so let's talk about getting your cat used to getting their teeth brushed. So I recommend first getting your supplies, and you may want to try a few different styles. I just have a couple of examples of, this is a finger brush. So you can just put it on your finger. It's got little bristles on the end. And then this is also worn on the finger, but it's a little toothbrush. So you can see you can use a baby toothbrush. You can use gauze. Like you can get real creative with the dental care. So don't get too hung up on, oh, I need this or that. But you might want to try a few different toothbrushes just to see what you like and maybe what your cat responds to best. I would introduce the toothbrush with a treat that your cat likes. If your cat likes churu or something similar, so those are little pouches of like meat paste. They're kind of like Go-Gurts for cats, or like chicken baby food might be another good option. You can just put a little bit on the toothbrush and let your cat lick it off the toothbrush. Don't even try to brush. Just introduce the cat to the concept of this weird little object on your finger that's going to have something delicious on the end. You also want to find a toothpaste that your cat really likes. Do not use human toothpaste. Use a toothpaste for pets. Here's just an example. If it's the right kind of toothpaste, your cat will love it and want to eat it as a treat. So try a few flavors, try a few brands until you find what your cat really goes bananas for. It's out there and it's designed to be tasty. So it might be chicken, might be turkey. I think there's like marshmallow flavor. So just try them. And again, your cat should respond to it as if it's something yummy and tasty. And then you're going to plan your considerate approach. And what that means is really, what is my strategy in getting my hands in my cat's mouth to brush their teeth? How am I going to do this in a gentle and positive way? Prepare yourself to be patient. This may take several weeks. You may never get to where you want to go, and we'll talk about some alternative strategies when it's not going well. perhaps you're going to start with getting your cat used to being touched around the face. Now, I think one thing about humans, okay, my plan is I want to get my fingers in my cat's mouth. So what do? I go up to my cat and I put my finger right in their mouth. Like, no, don't do that. That is going to be too much too soon. So maybe start with just getting your cat used to touching them on the face, above the neck, and give them some treats. And then you're going to gradually work your way in towards the mouth, but you got to start far away and move in gradually. So, we sometimes refer to this kind of approach as a gradient of touch, where you are going to start gently and far away, and then you move closer and then increase the pressure. You may also want to choose a time when your cat is kind of mellow. So you don't want to like chase them around and like pin them down to do this. You want to pick a time that they're like in a good mood. Maybe they're laying on the couch, and then start the gentle touching around the face or the introduction of the toothbrush with some treats on it. Then we're going to kind of plan. Okay, so there's a couple of approaches. One of them is what we call desensitization and counter conditioning. And desensitization is slowly and gradually exposing your animal to something that they're maybe not so into. So it's kind of like a volume knob. So you're going to start at a very low volume, gradually turn it up. Counter conditioning is the pairing of something unpleasant with something pleasant to change your cat's emotional response. So that would be the pairing of the toothbrush with treats. So this is just an example of an approach you could take. So I recommend like writing out all the baby steps to getting from A to Z. So maybe A is allowing your cat to sniff the toothbrush. The toothbrush is just on the floor, not even attached to your finger. Just let your cat check it out and put some treats nearby, or put the treat on it. Let your cat lick the treat off the toothbrush or eat the treats near the toothbrush. Maybe a few days later, you're moving up to, well, now I'm going to ask my cat to sniff the toothbrush while it's attached to my finger. And I'm going to make sure to give them treats during that. And then we're going to move to giving them a small amount of the treat on the toothbrush. Maybe now I'm going to do some facial touching with treats. So treats are at every step of the way. I'm very generous with the treats when we're doing training. And then so on until you work up to like getting your fingers along the side of the mouth. Maybe you're just touching along the lips. Then maybe you're lifting the lip. So really going very slowly. This, like I said, could take a long time. And then there's definitely a movement that I'm really excited about. I can't say that this is like my area of expertise. I'm just really excited about it, and I'll give you some resources on cooperative care. But the idea of cooperative care is that your pet is consenting to these procedures and that you train them to give a signal to say, it's okay to touch me now. Usually that signal is having them sit in a particular location and, for example, resting their chin on the edge of a table or box. And basically they learn that when they do that is when you will touch them, and you will not try to force the activity at other times. So you're really giving them the choice to stay or go. You always give them lots of rewards for letting you do what you want. But the idea is that they have full consent. And when they withdraw your consent, you stop. And you can add counter conditioning and desensitization to this once you've trained them to station. Like I said, it's definitely not my area of expertise. It's just something that I really want to get more into myself. And I have some resources for you on this topic, but I think it's really cool. Okay. We also want to know when things are not going well. So I will say that I don't think that brushing your cat's teeth every day is helpful if you're stressing them out. We know that stress increases the risk of health issues. So I've definitely seen cats get FIC, which is feline idiopathic cystitis, which means they are having stress-related urinary problems from things like having their ears cleaned every day, being bathed on a frequent basis, being over-groomed. So I have no doubt that if your cat is really freaked out by you trying to brush their teeth and you force the issue and do it day after day or try to do it day after day, you are not going to be in a good situation. So what you don't want to do is give up, but you need to step back. If you're having problems, let's look at some other options. So some other options, toothpaste only. Remember, you find a toothpaste that your cat likes as a treat and you just give it to them. Toothpaste has enzymes in it, so it's going to be better than nothing. Hopefully it will distribute its way throughout their mouth, get some on the teeth, break down some plaque, and it will do more help than doing nothing. You can also use the toothbrush with churu. So if your cat does not particularly like The toothpaste, then use another moist treat that they do like, and just try to get a little bit of activity on the gums. So when you're getting into the mouth, I should explain toothbrushing briefly. It's not like brushing your teeth. You don't need to do 30 seconds on every quadrant. We're really just trying to get a few swipes on every quadrant, so you don't have to get too involved in spending a lot of time. Really try to get in and out, a couple brushes on each quadrant, and you're done. If your cat does not like the toothbrush, you're really not having a lot of luck, you can use a Q-tip with some tuna juice or something similar to, again, just get a little abrasion on the teeth and gum line. So we're really just trying to break up that plaque and not let it accumulate. You can use dental treats. So I'm a big fan of the larger kibble. Sorry, let me get these in the camera. Some cats will actually chew these, so it can be very helpful. And you can also use them as a medium for the toothpaste. So if your cat likes the toothpaste, they like the treats, put the toothpaste on the treat, they chew the treat, it moves around the mouth, it's getting the toothpaste around the mouth and possibly giving a little bit of pressure on that plaque. You can use dental wipes. You can use VOHC approved water additive. So VOHC is Veterinary Oral Health Commission, I believe. And so they approve a lot of dental products for pets. And of course, you always have the opportunity to take your cat to the vet for a full dental if they need it and you are not having luck with other things. So we do the best we can. That's really, I think the moral of my story is we aim high, but we also accept what we've got and what we have to work with, and we do the best. And when we can't do what we want, we look at what else can I do? Every little thing you do is going to help. So if you can't brush every day, maybe you brush 3 times a week and then you do dental treats with toothpaste on them on the other 4 days, or maybe one day you use the dental wipes. So get creative. Don't feel like you have to do the same thing every day. The goal is really just to maximize the amount of dental care we can provide. It doesn't have to be this rigid, like if you don't do the toothpaste and the toothbrush, you're a failure. Do some other things. Give it a try and try not to stress your cat out. Okay, so what not to do? Don't give up. Don't do nothing. Most of us can give our cats at least dental treats. Do not do anesthesia-free cleaning. If you want more information on why this is a dangerous and painful thing to do, I've provided a link for you. I don't have time to get into the details, but it's definitely not something that is recommended in the veterinary community. Do not use any toothpaste besides cat toothpaste. So you can use, like I said, use Churu, but you don't want to use, basically what I'm saying is don't use human toothpaste. That's no good for your cats. And don't give your cat bones unless your vet says it's okay. Okay, here's a few resources. So these, I didn't put the hyperlinks in because they're super long, but if you can't find these articles, get in touch and I'll help you. But iCatCare has a great article on how to brush your cat's teeth that gets into the details of what you got to do. Cat School has a really cool video on cooperative care and training your cat to accept having their teeth brushed. So if you Google Cat School, successfully brush your cat's teeth with these training steps, you'll see the amazing video. Cooperative Veterinary Care is an awesome textbook on training animals to be active participants in their medical care. And the website for that book is teachinganimals.com. I've also got a few resources here for information about pain scales. So there's painfreecats.org, there's felinegrimacescale.com. You can Google the Colorado State University Feline Acute Pain Scale, and you can go to animalpain.com.br for information on the multidimensional composite pain scale. These are mostly recommended if you work in the industry, you're working with a lot of cats, maybe a veterinary clinic. Otherwise, like I said, I think the Feline Grimace Scale is an excellent resource for most of us. And on that note, I'm going to wrap up and take your questions.
Hi, thank you, Dr. Delgado. Wow, so much information, always so little time and so many questions. It's a good thing that we keep these webinars up on our YouTube channel so people can rewatch and can have these questions answered maybe in the future. You know, you guys can always message us on social media, send us an email. I wanted to start with the part about prevention. So you talked a little bit about how to prevent pain. And then we always, including today, get a lot of questions. Well, my cat's teeth seem fine. My cat doesn't seem to be in pain, but the vet said she still needs a cleaning, or does she still need a cleaning? Or if everything looked fine. And Dr. Cash, I wanted to maybe ask you how often this happens, and maybe tie that into our dental test as well.
Yeah, I mean, I can start for sure, Nadia. And I think a lot of the time, a lot of cats don't actually ever see the vet, let alone for a dental issue. So a lot of the time what we do see, and why the veterinarian might be spending more time in the cat's mouth, is because the owners maybe noticed that they're dropping some food, or they've been pawing at their mouth, maybe drooling a bit more, everything that Dr. Delgado mentioned. So there may be other signs that are indicative of some dental pain. And maybe we see something that's not obvious, like plaque or tartar, which might look like some dark color on their teeth. Maybe the veterinarian noticed that there was a tiny red line on their gums, which is indicative of gingivitis. So there's other signs that we can look for, things like tooth resorption, where we might not really see a lot just looking visually, but there may be a reason why your veterinarian is recommending a dental cleaning. So that's the best time, especially if you think there might be bigger problems coming down the road, to do a dental cleaning, because it gives you the best chance when you do start to brush teeth and incorporate a regular routine. Then it gives you the best chance at keeping on top and reducing that buildup. So I'd love to hear, Dr. Delgado, if you have anything to add as well. And the last thing I'll say is, if you have done a cleaning, that's the best time to check, what is the oral microbiome telling us? And, then, this is what healthy looks like for my cat. And then as you keep up with your dental care, you can also just check and make sure, hey, is it still the same as when I got a fresh new cleaning, or am I falling behind? Do I need to up my prevention a little bit more and avoid some of those high expensive dental bills?
That's really important. I would just add, pain is a very subjective experience. And I think even in humans, you can, I know we all know someone who's experienced back pain, repetitive stress injuries. You can't see it by looking at them. So you can't make assumptions about what your cat's experience is. And I would also say, if we only went to the dentist when we had dental pain, like, our teeth would be in much worse shape. So we don't want to wait until there's a problem. We want to get things before they become so severe that your cat is experiencing pain. Yeah, they might not be in pain right now, but if you don't do a dental soon, 6 months from now, they will be in pain. So if your vet notices plaque on the teeth and the gum line is looking irritated, then it's certainly better to do something now than wait until your cat is pawing at their mouth, dropping food while they eat, and then obviously in pain.
Great. And just for everyone watching and anyone who registered and maybe watching this later, usually after each webinar, we just send out an email with the link to this, the recording, and also you'll get information about Dr. Delgado's website and a discount code to our dental test. So I know some people were asking about your contact details. We got a question submitted to us a couple of days ago at the event page, and I think this is for both of you. Someone noticed that their cat, when they scratch their chin, the human's hand is wet. Now, we are not here to diagnose, but could that be a sign of dental pain, excessive drooling?
Sure.
I'd love for Dr. Delgado to chime in. Yeah, go for it.
Yeah, I mean, it's like I said, the thing that would always concern me is the sudden change. Without knowing the age of your cat and like his personality. I mean, some cats do drool pretty copiously, even without dental disease, usually when they're relaxed, right? So the mouth is relaxed. So they're maybe not holding in the drool. It's not getting swallowed. So it's just ending up flowing on your hands. So it could just be no big deal. But certainly if this is a new thing, I would be like, I should keep an eye on this.
Dr. Cash, do you want to add anything, or?
It actually reminds me of a really nice cat that the owner was really concerned about it drooling. So we actually just looked in the mouth to make sure that it wasn't because of a dental issue. It was just a really happy thing. So that's good, but it's always just, again, yeah, I would echo what Dr. Delgado said. Just get it checked and make sure that we're not missing something.
And I see, Brooke Evans, thank you for your questions. One of them was whether dental cleanings come with x-rays. And this question, but also several other questions we covered in one of our previous webinars. We'll still answer it, but I'm going to share the link to our previous dental health webinar right here in the chat. For anyone interested, we had a board-certified veterinary dentist talk specifically about, the veterinary aspects of dental cleanings, dental disease. But please, Dr. Cash and Michael, go for it in terms of x-rays.
Yes, I would definitely go back to that webinar because, neither of us are veterinary dentists, but there is definitely the benefit of getting a look inside of the gums with if you're doing a dental cleaning at your veterinarian, because they're always going to do x-rays. And the reason that it's super important, especially with cats, is over 60% of their teeth are where we can't see them, so up in the gums. And a lot of disease tend to start where we can't see it. So especially tooth resorption, that's something where we see signs when the disease has progressed so far. So all of the dental cleanings at your veterinarian include anesthesia and x-rays, and that's really where we find a lot of the pathology. So again, the only other way for us to really get a good look in the cat's mouth is through, something like checking the oral biome in a way that's less invasive than doing an x-ray, but by no means is that a substitute. But it's one of those things that we can do, at home in the comfort of home, just to keep an eye on things. If we think, my cat has a fairly healthy mouth, I can have a dental routine. I just want to make sure that I'm doing everything that I can. It's a really good way to kind of keep an eye on things. Is the biome changing, or is it pretty steady? That would be something that would be good for you to do. Dr. Delgado, if you have anything to add, that'd be great.
Just that there might be other circumstances that your cat needs x-rays without the dental. When I adopted one of my kitties, she had a broken tooth, and the vet couldn't tell if it was also growing in incorrectly. So she did have to do some x-rays, and she was able to determine, okay, things are fine. But it was unexpected, and certainly she didn't need a dental cleaning, but sometimes there are other dental issues that can come up. So always good to have a vet, again, look in your cat's mouth, see what's going on.
Awesome. Great.
And of course, as always, we have a bunch of questions about specific products and specific toothbrushes, toothpastes. As a part of the dental report that you receive after you do the Basepaws dental health test, so cat dental health test, we do provide a list of recommended products. And I also shared the VOHC, Veterinary Oral Health Council approved products. But someone brought this up, dental toys with netting. Does that function like floss? And do either of you have experience with these kinds of toys?
I would say if it's not VOHC certified, then it's questionable how much it's going to do. And certainly cats' teeth are not like humans. So yeah, I wouldn't necessarily use that as a replacement for the other methods that I recommended.
Yeah, I would just caution against anything that's, stringy or has netting, anything like that, especially with cats. We don't want to create a problem and require surgery and things like that. So yeah, exactly what Dr. Delgado was saying, the VRC approved products, those are kind of the best that we have in terms of combating dental disease, but also taking a look at those personalized recommendations from the dental report, so we know exactly, what are the kinds of prevention and treatment that might be best for your cat. Would be awesome.
Great. Another question. So My vet said that if my cat gets a dental cleaning now, they will always need a dental cleaning, even with daily brushing. It's almost like it was hair, right? That keeps on growing back. Is that true? I know we touched upon genetics and dental health, and we also talked about how, without X-rays and without checking your cat's oral biome, you really cannot know that there's something wrong. But is that correct, that dental cleaning once just means dental cleanings forever?
No, I mean, I don't think so. I had a cat who had one dental cleaning and she never needed another one because I did dental maintenance for the rest of her life. And so she didn't need another dental. So this really touches on two things. Yes, some cats are going to be predisposed. I mean, some of us unfortunately have lots of fillings. And I know people who don't have any, but I'm not one of them. So, genetics plays a role for sure in that susceptibility, but that's not destiny. We can definitely prolong time between dental cleanings for some cats, and we can prevent dental cleanings for some cats. But, that doesn't mean you shouldn't get a dental cleaning now if your cat needs one. You really just have to provide the medical care that your cat needs when they need it.
Yeah, I can add a couple of things here. It's a dental cleaning is not a horrible thing. It's an intense thing because for a cat especially, you're going into the veterinarian, you're being put under anesthesia, and it's a process and it's stressful. So I think we always try to stress that prevention is the best cure. So if we can, prevent some of the major, extractions and things by keeping up with the routine care, that would really minimize the chance that you're going to need extreme, extractions and things like that. But a dental cleaning, especially if you're, have a cat that's got some previous problems, the cat's older, it's something that can really enhance that cat's well-being and life and health. So it's something that we don't necessarily want to discourage, but we want to make sure that once we do the cleaning, we don't stop thinking about it for another 2-3 years. We want to use that opportunity to kind of get back on track with all the prevention so that we can prolong having to do them. And, they're never really too old to get a cleaning. And if they are predisposed, then we just, try to figure out what works to actually minimize or prolong those dental cleanings so we have more time between cleanings. So it's not a horrible thing. It's just, we want to try and do as much as we can to avoid that stressful event in a cat's life if we can.
Great. We'll just keep on going with questions. Is it normal for cats, and this is more in the behavior, feeding behavior side, not to chew kibble, but swallow it whole, or to juggle around kibble from one side of the mouth to the other? And another question we often get is, with dental treats, my cat, or dental chews, my cat just swallows them. Dr. Delgado, as a behavior consultant, what do you advise in these situations?
Yeah, some cats, if you've ever seen a cat regurgitate after they eat, you may notice that the food does not get chewed very much. And as I mentioned before, their carnassial teeth, which are the ones along the side, are really designed to shear meat into strips that they swallow. So yeah, cats don't chew. Like I said, they're not going to chew each bite of food 32 times like we're supposed to. If your cat is switching sides of their mouth, I guess I'd be concerned again if it was a change or if they were favoring one side of their mouth. Again, great reason to take your cat to the vet once a year is to get that mouth looked at once a year. But certainly, again, if it's a new behavior, they'll be like, what's going on? Cats, I don't eat on the same side of my mouth all the time either. So, I don't want to say like, oh, it's obviously a sign of problems. But yeah, if they were really favoring one side of their mouth, I'd be more concerned. As far as the dental kibble and treats, I prefer the larger ones because I find that cats do tend to chew them, at least break them once or twice. And as I mentioned, if you put some toothpaste on them, they'll lick it quite a bit and manipulate it in their mouth a bit more. But some cats are more chewers than others. So, that method isn't going to work for every single cat, which is why I presented you with a list of like 10 different options for dental care. So yeah, what's going to work for one cat is not going to work for another. But I have found that the dental kibbles are are quite effective at keeping the teeth reasonably clean, combined ideally with other methods.
Great.
That's
Dr.
perfect.
Kat? Yeah. And then back to the behavior side of recognizing signs of pain. Claudia asked a great question here. How do we know whether your cat is exhibiting signs of stress, anxiety, or is it pain? Are these signs similar, and how can we distinguish them?
Yeah, I mean, to me, stress and anxiety are signs of emotional pain, and those also deserve medical treatment and attention from your vet, at least a consultation. And maybe it means some environmental changes rather than medication, but it's certainly not something to ignore. And as I mentioned, I think people do normalize a lot of signs of pain, fear, anxiety in their pets. Oh, he just, he lives under the bed, or oh, he lives on the fridge. Oh, he doesn't like X, Y, or Z. So it is important to discuss these issues with a veterinary professional or a behavior professional. But yeah, some of the signs can overlap for sure. Again, a good way to rule out pain is to get a veterinary exam, because your vet will give your cat a very thorough once over from nose to the tip of the tail. So then you can feel confident that you've ruled out any physical problem. Certainly when people approach me for a consultation for an anxiety or stress related problem, I always want that cat to have been seen by a veterinarian recently, so that we know that the cat is free of physical conditions that might be contributing to the problem.
One thing I'll add is, I think maybe it was in the comments earlier too, is when your cat is at the vet, they're putting their brave face on. So sometimes we actually don't see some of these stress and anxiety related behaviors. So, things like video, those are always useful. And even, having your veterinarian and a behavior specialist, working together, I think that can really help as well.
Great. And Dr. Delgado, since we're talking about behavior and taking your cat to the veterinarian, is there a resource where people could look veterinarians that have behavior specialties up? Because, we've got fear-free certified, we've got feline friendly. Is there something like feline behavior knowledgeable veterinary practice?
Yeah, so veterinarians can be board certified in behavior. So I want to say it's the Diplomats of Animal, DAVCB, I think. I don't know, Dr. Cash might know. So if you Google veterinary behaviorists, you will see there's a guide to all of the veterinarians. So these are veterinarians who got additional training. It's usually a 3-year residency in behavior. They have to do research in behavior. They do consulting during that time. And then they have to pass a very difficult exam. So these are veterinarians with additional training specifically in behavior.
Great. And we've got plenty of questions. This is not related to dental health, but since we've got you on, Dr. Delgado, someone has 6 cats. They kind of get along. There are 2 females, 4 males, all fixed. All females hate each other. The one female will urinate everywhere to be spiteful. How do I stop this?
Yeah, this is definitely beyond the scope of Q&A. So I would say talk to your vet and get help from a veterinary professional or behaviorist. So the veterinary behaviorist website is dacvb.org. So that is the American College of Veterinary Behaviorists. But yeah, you've got a lot going on in your household, and there can be a lot of things contributing. It could be, certainly you want to rule out any urinary tract problems, but it sounds like you have a lot of cats in your space, so you want to make sure the environment is set up well, and you might have to work on helping some of these cats have a reason to like each other. So yeah, sorry, not able to handle that one right now.
Absolutely. And we kind of have 1 minute left. Do you want to leave us with kind of the few bullet points, what you would like everyone to remember from this webinar? And I'll put up Dr. Delgado's website again.
Yeah, I would just say that, taking care of our cat's health is really important. And I do think that this concept of cooperative care is the future, where we're actually training our animals to not hate being treated. I mean, I see so many people that don't give their cats the medical care they deserve because they either are afraid to pill them, or they don't want to pill them. They don't want to stick their hands in their cat's mouth. And these are all things that people in zoos and sanctuaries can train lions and tigers and elephants to consent to blood draws and having their teeth examined. And so we can do the same with our pets. We just have to have the right mental outlook.
Great. Dr. Cash?
I'll just say, you know, on behalf of Basepaws, we're not going to stop, you know, finding those, you know, early indicators of things that we can prevent in terms of health and also behavior. And we're always trying to understand more about these cats because they give us so much. So we want to give that back to them.
Oh, that's such a lovely way to end. They give us so much. We want to give it back to them. Thank you, everyone, for joining. We're sorry we couldn't cover all of the questions. I know there were some very specific questions about brands. As we said, there is a list of recommendations that we provide with each dental health report, and we will send an email to all of you with instructions on where you can find that. Thank you so much, Dr. Delgado, Dr. Cash. This was fantastic, and thank you to everyone for joining. Love your cats. Give them a big hug if they allow it, if they like it. Otherwise, don't give them a hug, obviously. And we will see you again in August for another webinar.
Great.
Awesome.
Thank you.
Thank you. Bye.